Morning to everybody. A very good morning to you all. I'm Sue Jane from Healthwatch Enfield, and I'm the Community Outreach Officer. I'm not doing too much outreach at the moment other than like this at screens, seeing lots of faces on screen. So welcome to our event today. And I'm delighted that we have so many people interested in this later life planning session, and want to thank everybody for giving up their time to join the call today. And today we're talking about how you can plan for later life, what that means, what services and support there is available in Enfield, and answer some of your questions. From a personal perspective, I think this is a really important subject and affects us all. Later life planning is not just for older people. It's relevant if we own property, have children, are carers, and none of us know what the future will bring. I'm a really good example. About 10 years ago, I fell from my loft onto the ladder and every rung was an injury. I fractured my spine, busted my ribs and split my head open, and I thought I was a goner. And I only stayed calm because I knew I had a funeral plan and a will, and my passing would not be a burden on my loved ones. I believe this slowed down my blood loss, and I'm still here to tell the tale thanks to Chase Farm Hospital and the London Ambulance Service. So moving on, we have a panel of speakers who I'll introduce properly in just a moment, and they are from Age UK. Kate, can you give us a wave, please? Thank you. That's Age UK Enfield. And we have University College London, Dr. Nathan Davis. Give us a wave, please. Thank you. And from Enfield Carer Centre, we have Karina. Again, can you wave for us? Thank you, Karina. And North London Hospice, Hannah. Thank you. Fantastic. They'll be talking about the range of services they offer and about many other services and support available in Enfield. So it's important to highlight today that we are not here to give medical advice, although we do have one registered nurse and one doctor on the panel. However, between us, we'll try to answer all of your questions today about what help is available, or put you in touch with the right organisation who can. If necessary, we'll follow up with you after the session or in a fact sheet if we don't have the answer right away. So in terms of the topics we're due to cover today, we have a wide variety of people on the call, from members of the public, all with different needs and reasons for being here today. That's carers of older, frail or dementia loved ones, older and elderly people themselves wanting to plan their own support, families looking after loved ones with learning disabilities, those starting to think about care homes or extra care at home, people wanting to know where they can get legal or financial advice, and a lot more besides. So, as we only have an hour and 20 minutes, today is very much an introduction, call it a taster, to a whole range of topics and services in the borough to help planning yours or your loved ones' later life. We will share a useful information and fact sheet with all the links on it after this session, so you can follow up in more detail about any of the subjects we talk about today. And we'll also pop some details in the chat as well as we go along. You can rest assured that we'll only be sharing information about verified, properly registered services that are either free or not for profit in the borough. So we're going to start with a very short introduction from each panel member, then answer the questions that some of you have already sent in when you booked, and the panel will talk more into detail about their services as we go along too. And then if we have time at the end, we'll take some questions from the audience. And just as an optional extra at the end, we've got a fantastic 10-minute meditation session for anyone that's interested, just to lighten things up a bit and provide a relaxing start to the afternoon. So let's begin with Dr. Nathan Davis from University College London. He's a Senior Research Fellow specialising in dementia care. Thank you, Dr. Davis.
Thanks for that. Can everyone hear me? Good, good. So yes, I'm a researcher at University College London, and I specialise in dementia research. I must say I'm not medically trained, so I'm not a medical doctor, so please don't ask me any medical questions to give answers to that. But I do a lot of research on dementia care and how we can best support people who've got dementia, and I do a lot of work which focuses on the end of life and people who've got severe stages of dementia as well. So quite often those that don't have capacity to make their own decisions, for example, and families are having to support them quite a lot. And so I do a lot of work looking at how we can then best support families to make those decisions and to provide the best care, really. And I think certainly over the last 12 months, and certainly yesterday with the really awful news that we now have over 100,000 people that have died with COVID, I think that the pandemic has really highlighted to us that we're not all immortal, that death is something that happens to all of us, and that planning for that is something that we should be thinking about and can think about as well. And so some of the questions that I've thought about for today are really about, can we plan? So I think one of the big uncertainties in life is life itself, really, isn't it? But we can still make plans for our life, and we can do that from, when we leave school and start to think about what our career might look like, and then we think about how our career is changing or how our family life is panning out and how that's going to change. But we can also think about later life as well, and that might be towards the end of life and thinking about our ends of life as well and what we want from that. But we also need to think about, not everyone wants to plan, and we can't force people for that, and we need to respect what people want to do, really. But we can also think about why we should plan. And I think one of the big things in terms of dementia is that quite often people lose the ability to make their own decisions. And so some of the big things that we think about is how we can make sure our voices are heard, how we can make sure that others know what we want, and that actually, when we're not around to make those decisions necessarily, that others are able to make those decisions and don't feel guilty about decisions. And then one of the other things I was thinking about was, what can we include in our planning for later life? So what types of things can we think about? And we can think about where we want to live, who we want to live with, who we want to be cared for if we need care ourselves, and who do we want to make decisions about, that kind of thing as well. But also we can think about the simple things in life. So what is it that we enjoy, and what do we want people to know about what we enjoy, and what don't we like? And then the final thing that I just wanted to consider was, what should we consider? So we should be thinking about our values, our preferences, but also the values and preferences of other people that we might be providing support and care for, regardless of what condition they've got, and who you want to be involved in that as well. So that's pretty much what I wanted to say going forward, and hopefully that's a bit of an introduction to some of the things we'll discuss today.
That's great, thank you very much, Dr. Davis. And now I'd like to move on to Kate, please. Kate Reader is from UK Enfield. She's a later life advisor and a health and wellbeing navigator. Thank you, Kate. Over to you.
Hello everyone, hello. So I'm Kate, I am a later life advisor and I work for Age UK in Enfield. That's the context, kind of why I'm here today. So with our later life service, I run free planning for later life sessions, currently via Zoom. We hope at some point we will go back to in-person presentations. It's for people aged 50 plus or carers of people aged 50 or over. And the sessions are information giving sessions. So we don't offer legal advice, we're not unable to offer legal advice or recommendations, but we give general information so that you can go away and make informed decisions about your later life planning. The sessions cover wills, lasting power of attorney. I talk about advanced care decisions and statements and bereavement services. As well as the later life planning service, Age UK Enfield, we've got lots of other services available in Enfield for people aged 50 plus. Some are specific to people living with particular health issues, and others are available to anyone aged 50 or over. So I'm just going to give a brief overview of what we offer. So we have our Fit for Life service, where several exercise classes and walks occur weekly. At the moment, they're running online. We have our exercise classes running online, and we really hope that we're going to resume classes in person soon, and when safe to do so. We have health and wellbeing services, including our Full Stop service, where we have falls prevention navigators who support people who've either previously fallen or feel that they're at risk of falling. The navigators support people to access services in the borough to reduce the risk of falling and support independent living. And people are invited to attend Tai Chi classes to help with balance and build strength, and these are currently being held on Zoom. We have a memory care service where people are supported from the point of diagnosis. Support includes helping to understand diagnosis, accessing support, information and advice. Our health and wellbeing navigators also work with older people who are living with complex health and social needs, to help them identify and link with services that help maintain and promote their wellbeing. And that includes reducing isolation, social isolation, and accessing activities as well. We have a home-based support service offering domestic care and personal care to people in their homes. This is a chargeable service. We offer a telephone and online advice service on all aspects of later life, such as welfare benefits, housing, accessing benefits, housing, and general inquiries, general information and advice. We have a team of ICANN navigators who work with vulnerable adults. They work with people not just 50 plus, but people aged 18 plus who live in Enfield. They use a holistic approach, well, like we all do, to identify the needs they have to live a healthy and independent life. So working with people with dementia, diabetes, at risk of falls, who might have had a stroke, and people at risk of being socially isolated. Within that service, we run regular tea and chatter social groups, currently on Zoom. We hope to be back in person as soon as it's safe to do so. We have a fortnightly memory club, currently on Zoom, where we offer reminiscence, creative, social activities for people living with dementia and their family members. The Parker Centre is our day centre specialising in dementia care. We support people aged 50 plus who have early memory problems through to those with advanced dementia. We offer a stimulating and supporting environment with a range of activities, freshly cooked food, and options for transport as well. Currently, the staff are working with people in their own homes. After this event, I think Sue already mentioned, there'll be a fact sheet made available, and all the information that I've just told you, our services leaflet will be on there, as well as the Later Life flyer with all of the later life planning awareness sessions as well. Okay, thank you.
You're welcome. And Kate, isn't there an event tomorrow as well that you'd like to promote?
Yes. So the later life sessions that I run, I'm doing one a month at the moment on Zoom, and I spoke about them right at the beginning, where I talk about wills and lasting power of attorney and advanced care decisions and statements. I'm running one tomorrow. I do have spaces, so please do get in touch if you'd like to attend. The one tomorrow is 11 till 12:30, and I've got ones coming up in February and March, and I've actually just made the dates for up until June as well. So if you're interested, they're free to attend. Do get in touch.
There's a quick question in the chat box on something, Kate, for you. You mentioned support being given to those in supported living, and is there an age on this?
Okay, so I think that might relate to when I mentioned about the home-based support. What we mean is we have a home care service, so we have a team of trained carers who will go into people's own homes and provide support in their own home. So it might be that they provide personal care support, they support with giving medication, with cooking, with cleaning, with companionship, with making someone a cup of tea and having a chat with them. And if somebody was living in supported living and they wanted to access this service, that they can. As I mentioned, it is a chargeable service.
Okay, there was a question of, you mentioned housing in there for the general advice and information. Is that for 50 pluses, or is it for generally anybody age?
So our information advice is aimed at people aged 50 plus. However, if somebody did have a housing issue, we do have our ICANN navigators, so if they might be able to be supported in the context of the ICANN. So just if people just get in touch if they did have a need, and we can kind of either see if we can support them. If not, we try and direct them to somebody who can.
Fantastic. Thank you so much, Kate. Thank you. And Hannah, we have Hannah Newton from the North London Hospice, who's a community development ambassador. Hannah, welcome.
Hi, everyone. Hi. I'm going to tell you a little bit about our ways of working with people. and a little bit about our free services at the hospice, whether that's in one of our buildings or home-based. So hopefully I'm going to answer some queries people might have, and maybe even sort of bust a few myths about hospices. So some of the questions that might come up, or areas that people might want to explore, I'll just very quickly in 2 or 3 minutes go through this. And everything I say, it all fits into the bigger picture of life planning, and fits into the jigsaw of today. So it might be, and I'm just as you know, I think we've got such a short amount of time today. My aim today is just to give you a flavour, and it's not so much what I'm going to say in the information, because there's a lot of information to take in, but to get to know you all in terms of I could be a contact if people want to follow up afterwards and look at anything in further detail. I can help signpost, connect you to other parts of the hospice. So it could be that we want to explore what modern hospice means, what does specialist palliative care actually mean, how do we wrap all our multidisciplinary teams around the patient and the family and the carers. It could be people want to know about how to access our services. Who are the people that the doctors or the families and the patients might call first of all? Who are they going to be speaking to at our first contact centre? What's our referral criteria? We changed that recently, or we updated it slightly, so there's a bit more something to talk about there. Care in the hospice. What are the activities that help happen in our health and wellbeing centre in Winchmore Hill, and over in our inpatient unit in Finchley? It could be, we could have a look at our care at home. Our care at home is actually about 97% of our patients, and we help over 3,000 people a year out of a population, cover a couple of other boroughs as well, but a population of 1 million. So we've got, we can talk about our Enfield community team, and also our overnight service, how we have a phone line and visiting support service for families overnight. Or it could be, for the audience today, you may be interested in our support services for patients, family and carers. And this is a whole range of things. I'll just put a few things here. It could be our Kinship Support, which is something we're very proud of. It's a relatively new service we've added. It could be practical support. It could be how our family support workers help people with memories, making memory boxes and that legacy, and our remembrance events. I've put CMC here. Has anyone heard of Coordinate My Care, or indeed got their own Coordinate My Care plan? And one thing that we do at the hospice is every patient has a Coordinate My Care plan, which is very much, it's an urgent care plan for people with long-term conditions. And what's great about it is it's a digital platform, so the different services can talk to each other, 111, with the ambulance service, with the hospice, the hospitals. So you don't have to keep telling your story again and again. A lot of people know about it, but what perhaps people don't know is they've just launched a year or so ago My Coordinate My Care, which is where people can get involved in it themselves. Finally, it may be that we want to talk about our community action. So we've always been engaging with the community, but my role is quite new in terms of it's a designated community action type person. And why do we do that? It's a really big reason why we do this, and that's because as a hospice we're looking to nurture and engage and enable communities around us, local people around us, to feel more, I suppose, more confident, more willing to listen, be ready to listen to conversations around planning for later life, death and dying, and bereavement. And one of the ways we do that is through our Compassionate Neighbour scheme, which is our befriending scheme, and I can tell you more about that. Events at the end are things like our death cafes. So I've just put my email at the end. As I said, please, we can follow up afterwards. It's just a flavour of our services, and each area can be talked about, for over an hour. I imagine over the course of the hour, other queries will come up, and I've also got a few colleagues on the call today that may be able to add their thoughts, and they're from different services. So as it comes along, we can give them a wave. Can we have a quick?
I'll just mention one thing. In the chat box, there was a question about the coordinate my care plan. And hot off the press on our website, we've just put the information. There's a new all London residents can get a personalised care plan online. And we've just put the link on our website. So we will add that to the fact sheet, okay? Yeah. So that's going to be information that you can actually read up about and find out more information. But I hope that helps the person in the chat box. That will be going on there. And as if by magic, the link has appeared in the chat box. Fantastic.
Thank you.
Carry on, thank you.
I mean, probably people might know about it here already, but I was chatting to the organisation yesterday and saying, you know, obviously it's very important for the hospice to do it, but they're looking at trying to promote it a little bit more in care homes and in acute care settings. And I was saying, well, could anyone do it? And they said, well, yes, really. Anyone where you may want to record your medical preferences. And what's lovely is you can actually record personal wishes as well, such as I've got a pet, or the paramedics might want to know that my keys are with my neighbour should they have to come in and have to open the door. So it's, yeah, do look into that. I think it's pan-London, and I know there's services like this across the UK, but that's hopefully that's enough information for now. This little slide, I think I might just have 1 minute left or so. I just wanted to mention, we've just refreshed our website. Please take a look. The audience today might be interested in two particular areas of the website. The first one is our social care support, where we've got our first family and carers newsletter on there. We produced that just before Christmas. And that really shows it's not just medical support. When people get a diagnosis for cancer or another condition, it might not be just medicine that they might need. That feeling of loss, of your world unraveling, that can't be supported by medicine all the time. So it's all the other activities we've got as well. Quick, they say a picture. Oh, sorry. And the other thing I wanted to mention on our website that people might be interested, if you want to go to our wellbeing section, and in the wellbeing section there's one of our photography group, and it really brings to life how we work with our patients. Now, they say a picture can say 1,000 words, and this is our building in Winchmore Hill. People might know it as that building by Barrowell Dump, Barrowell Recycling Centre. It's modern, it's contemporary. This is where we have many of our activities for those who are able to come in. Of course, it's empty now. We've transferred everything online, and that's going really well. We've got sort of a bit more of a shorter list of activities of the 2-pager we had before, but it's still, you know, it's very positive. It is different. I mean, I suppose there's losses and gains. It could be harder for newer patients, but as we've had feedback that one of the activities they do is the highlight of this guy's week. So it's going very well. You can see in that building though, there's lots of cozy corners, there's big function areas, and that's so we can do those, people can have their talks, they can have their activities. Now the photo next to it, I think I've included this because it just really highlights how we work with people. What I want to leave today is sort of leave people with the day. This is a very different care setting from a hospital, and as you can see, there's no uniforms. You can't really tell who's a patient, who's a volunteer, who's a staff member. I think the only person who's got a uniform on is our chef, and that's because nutritional eating and coming in for the companionship of a healthy meal is very important to us as well. It's very peaceful, it's tranquil. I'm just seeing there's activities going on. So I think it just highlights really how we work on a very equal footing. There's I think we're trying to deprofessionalise sort of all the medical side of thing, and we just have that peer support. At the moment, on one of the sidewalls, there's a massive photography exhibition by our photography team. It is so vibrant. I think it should be in the National Portrait Gallery. It's so bright and beautiful. And again, this is around people living life to the full. When just because you've got a cancer diagnosis doesn't mean you can't enjoy coming out and using a hobby and having that as therapy and peer support as well. So hopefully, I hope I haven't gone on. If there's any questions, there's a few things that have come up in the chat.
There was one, Hannah, just asking, do you have to live in Enfield to access your services?
It's Enfield, Barnet or Haringey. Now, what I would say is our first contact team, so the number is on the website. They are brilliant at giving advice and support, and often they'd say we do get people who come who might phone up for a family member who's in Brent or another part of London, and they've got so much knowledge they can signpost as well. But you do have to so they and our first contact centre are in touch with other hospices, so don't hesitate to call them if you do have a, you know, I'm not quite sure this might work, I'm not, so they're very good.
That's great, thank you so much, Hannah, appreciate that. I'm going to move on to Karina Kodria from Enfield Carer Centre. She's a healthcare trainer and a registered nurse. Thank you, Karina.
Thank you so much, and hello again, everyone. And can I just start by saying thank you to our colleagues at Healthwatch for putting this together, and I hope that, you know, there's some brilliant resources today. I'm sort of hearing about all these services, and I'm just amazed how everybody's keeping going and we are all able to provide the support. So, you know, I just wanted to acknowledge that Healthwatch have done a tremendous amount of work, and we work very closely with Healthwatch. Just a bit about me. I mean, how I've come to work at the Enfield Carer Centre. My background is in nursing. I've done 20 odd years of nursing, but about 10 years ago, my mum developed dementia. And even though I was in the healthcare setting and I thought I knew the system pretty well, which I did, I still found that experience extremely overwhelming and very, you know, very intense, and it took its toll on every single aspect of my life. My mum passed away 4 years ago, almost, and since then I've become involved with the Carer Centre. So my main role is to do healthcare and clinical training in a basic format for carers, as well as running healthy living days. We used to obviously do everything in person, but now unfortunately we had to move everything like that onto Zoom. We offer at Enfield Carer Centre, we take care of the carer basically, so the people that look after somebody who has an illness or a disability. It doesn't have to be a relative, it could be a friend, but if you are providing substantial and long-term support, ongoing support rather, to a friend, a family member, a relative, and as long as either themselves or you live in the Enfield borough, then you are a carer, and you can join our organisation for support. We offer practical support as well as financial support. We offer advice, signposting, legal services. So there's a very, very broad range of support services that we offer. I just wanted to share our latest newsletter with you. So it's just for a sort of a brief guide of what we offer. Our website is enfieldcarers.org. So if I'm just going to share the screen and to just show you a little bit about what we do. So just bear with me. Hopefully it will come up. Are you all able to see that?
Not yet.
Not yet, okay.
Oh yes, it's pinging up now, thank you.
Right, lovely, okay. That's a really...
Slowly loading.
Right, okay, so we produce a quarterly newsletter, and that is very comprehensive. It covers every single, you know, service and support that we offer. It is not limited to that. So if you have got a question, being a carer is tremendously challenging, and it's a very valuable job that you do. It's a 24/7 job for some people. Some people look after more than one person. They might have young children as well as older parents to look after, and those people are sandwich carers, and that job is incredible and it's very valuable. And I would also like to say, if anybody's finding that they're not able to continue into paid employment while they're a carer, don't think that you are out of work. What you are doing as being a carer, looking after somebody, is a very valuable skill, and I would strongly encourage you to use that into your CV, to add it as a very valuable skill set, and to talk about it if you do want to join, you know, paid employment later on, if you're able to. And we can offer you support with that as well, if you're struggling with employment issues or anything like that. So just briefly to run through all the services that we do without taking, too much time, because it is very comprehensive what we do, and you can always go onto our website and have a look for all the information over there, or you can always give us a call. So we have recently started a home care service. It is a paid service, and these are the rates, and you can call us. Also, we also do unpaid support, so it's also we can do what is known as replacement care. So if you're finding that you're really exhausted and you're a carer and you need a break, you need to just recharge your batteries, you want to have a good night's sleep, give us a call. We can provide that the replacement care for you free of charge as well. So we also do, this is the team for our home care division. This is Alex in the first photo at the top, and he's the manager, and they're all very friendly, so feel free to give them a call. We also have an ICANN service, pretty much like Age UK. There are, I think, 4 ICANN navigators, and they do provide a very holistic and comprehensive service to anybody who's struggling with various issues regarding, navigating their way into, day-to-day life, whatever challenges that you might find that you're having. Okay, we always promote, so when we have funding, which is currently happening at the time, currently we have received quite a bit of funding for transport services. So if anybody's struggling with, having transport to and from a medical appointment or anything that's to do with caring role, give us a call, we can help with that. And we have hardship funds, as I said, respite funds, and a wealth of resources. So we can offer practical as well as financial, some financial support depending on the resources. And obviously everything like that would be means tested, so we would have to do a means tested assessment. We can help people get online. Obviously, anyone who's connected today, you are able to get online unless anybody is over the phone. But if you really feel left out because of technology, we can help with that. If you're a carer and you find that you're perhaps struggling with that, we can give you that support. We have also supported children in continuing to learn online, and we have lent out electronic equipment in order for them to do so. We run well-being workshops. We work very closely with IAPT, which is Improved Access to Psychological Therapies. We offer free counselling services in line with that, and we can also support you in in your struggles psychologically with the role of being a carer. Our counselling services are free, and usually they happen. I know IAP have sometimes got a bit of a waiting list. We offer the service with a bit of a shorter waiting list, on average being about 6 weeks to access our counselling services. We also offer debt advice, which is free. And also benefits advice. Benefits advice is a minefield, basically. So anybody who's a carer and they find themselves are not able to work and they're literally exhausted with all the the caring role, we can help. We have a very one of our benefits advisors is specialist in, she used to work with DWP, and she's now worked with us for about 3 years. Her name is Marian, and she is really, really friendly, and she will help you navigate the benefit system, which is quite complex. Especially the help is especially challenging for people who are older or don't have access to the technology. We do stretch and relaxation classes, as I said, and we also, something that's quite important, which I'm going to talk about a bit more detail, we offer legal information, and everything that we do basically is in this newsletter. Just to promote a couple of events before I go, and not before I go, before I finish, talking about what we do. On Thursday, the 4th of March, we have an online Healthy Living Day, and it's free health advice with myself, and we also have a qualified nutritionist attending, and people from IAP. We do exercises, so it's just fun, and I would encourage you to come along, and even if it's just to sort of socialize and take part. It's very informal, very relaxed, and it's at the moment obviously is via Zoom. And also we have first aid training. It's all online. If you want to have the link shared later on, please let us know. I also do a clinical training for carers, which is in a basic format. If you can ask me during the session. I'm very open to ask any questions that you might be struggling with, your medical queries, hospital GP challenges, anything like that. We know that at the moment, GP services are very, very under strain. Personally, I've had a terrible experience in accessing GP services. They are so overwhelmed. They're having to cope with, what's going on. So if you're struggling with that and you think you might need the advice, please come to us and let us know.
Can I just, I'm going to have to move us on a little bit, I'm afraid, because we've got so many questions we need to answer. We've had a couple of questions about the ICANN navigators. What does ICANN mean? Is any of the support, like the getting online for the cared fors as well, please?
Sure, lovely. Okay, so people would have to register with us, first of all. So if anybody wants to access the support services, so this is ICANN. Our ICANN navigator, her name's Cheryl, and it's people who are support offered to people who have been diagnosed with long-term conditions like diabetes, dementia, stroke, falls, or anybody who's struggling with social isolation or just need end-of-life care. So if you are a registered carer, which is a very straightforward process, we can help you with that. All you need to do is give us a call, and then we can take it from there. So we can refer you to Cheryl for the ICANN services.
And with the IT classes, can the cared for access support with that? Of
course, yeah. The support is also available to the cared for, definitely. Somebody who although the support is aimed at carers, we would never turn down the cared for to attend together with their carer, so that people can come together, they can join us together, and they can do that. We don't directly support just the person who's cared for on their own individually. Our support is aimed at carers, but if somebody joins together, they can attend our classes, our support services, anything like that. Together, and that is often the case, if I may say so. It's often the case. We find that people do want to participate.
I'm going to have to move on to the questions now. We need to start with thank you so much.
Thank you so much. Thank you.
We have. I'd like to open the floor for any questions on dementia, actually, because we'd like to cover that first of all. Is there anybody that has any questions on dementia specifically? If not, I'll go on to the questions that have already been raised. I'll go have a look in the chat. Can we stop sharing the screen now? That'd be great. Thank you so much. Yeah.
It just takes a while for everything. I think we got like a few seconds delay.
Technology, we love it.
Yeah, exactly.
We don't have any questions just yet. So what I'll do then is I'll go on to the questions that have been put to us. We've had a question from Tracy Anang from Enfield Disability Action. In later life, some people want to stay in their own homes rather than go into residential care or nursing homes, but they tell me they feel pressurised to go into residential care by family. So what support and legal advice will be offered to those affected? And perhaps, Kate, you can help with that one.
Yes, right. Okay, I think the first thing to say would be that the support and legal advice available would obviously depend on the particular circumstances, of the individual and the context and things. However, I just wanted to mention a couple of things that bear in mind. So first would be whether the person has capacity. So if the person has capacity and wants to stay in their own home, then they may be able to with the right support, with the right support in place. This could be with support from family, friends, or through paid care. You can request a care needs assessment from the adult social care team, the social workers. And there's also a list of care providers and guidance on this in the Enfield Care Directory, which will be referenced in the fact sheet that we're going to provide after this event. If the person has capacity and doesn't have anyone to support them, then they can look at an advocate and an advocacy service to support them. If the person doesn't have capacity and doesn't have a lasting power of attorney in place, often referred to as LPA, lasting power of attorney, they can have an independent mental capacity advocate. Sorry, that's a really, really long word. But often that's abbreviated to IMCA, who can look at their best interests and the options and support available. If there are particular concerns, you could always contact a solicitor to discuss. For information and details of local solicitors, we've given a few examples. Again, they're going to be in the fact sheet, but there's solicitors for the elderly, the Solicitors Regulation Authority, and the Law Society, to name a few, who can offer legal support and advice, and all of the things that I've just mentioned. So it's a real kind of, you know, whistle-stop tour, but it's all in the fact sheet for everybody to look at.
That's fantastic, Kate. And I think we've got to notice there's so much information being offered here today. I'm not expecting everybody to remember everything because it's just a lot of information. So don't worry, we're going to put as much information into the fact sheets as we can, so you haven't got to think, oh gosh, what was that? I can't remember that. Just relax. We're going to provide that fact sheet. It will be on our website, and we'll share that with people, so don't worry about that. And the second question is around the vaccine. That it has, obviously the vaccine started, but there's a question about when will people get that? When will people start getting their vaccine? Well, it's a tricky one, obviously, because it depends on circumstances. Are you extremely vulnerable, and so on and so forth. But there is one thing I need to highlight to you all, I think, is the track and trace scam email that's going around, offering people a vaccination if you click on this link and give all your details, basically, and bank details, the whole malarkey. So please be careful before you do get, you react to anything on an email. It's normally you get a letter from the NHS if you're extremely vulnerable. It can be a contact from your GP, it could be a text, it could be a call or a letter or an email. And also, if you're an unpaid main carer in Enfield, you may be eligible to get a higher priority now. They've actually changed the priorities for that. So it's useful to know about that. So it is a changing thing almost a daily basis, but they are getting, as you know, the vaccines are coming through thick and fast. We've had some really positive news about it. People are saying that it was a really quick process. They were in and out. They felt really confident about it. So that's the best I can really do at the moment. And also to look at our website, keep up to date with what's going on, sign up to our fact sheets and our newsletters, and we can update you with the latest news and information. And it's all verified and tested. So please do that for us. So that's helpful, and I hope that's covered those questions. The next one is, how do you determine mental capacity? Is there a criteria to follow? Well, again, there's the Mental Capacity Act 2005, golly gosh, we're going to give you the links to all of that. And there's a great link from the Alzheimer's Society around what that means. But basically, the Mental Capacity Act is a law in England and Wales that protects and supports people who lack capacity to make a decision, and it outlines who can and should make decisions for them. There's things it doesn't cover, obviously, but there's also links we're going to provide from the Dementia Association as well, which is really relevant to that. So mental capacity is the ability to make a decision, whether it's an everyday decision such as what to wear, or an important decision as where to live. So it's a really important thing to get checked out. And there's a two-stage test to work it out. Again, that needs to be something that we will put on the website rather than go into detail today, because it's quite complex. Okay, we're going to share all those links to you. But effectively, someone lacking capacity, it could be because of an illness, a disability like a mental health problem, dementia or a learning disability. And it could be that they cannot do one of these 4 things: understand information given to them about a particular decision, retain information long enough to be able to make the decision, weigh up information available to make decisions, and communicate the decisions. So it's a jigsaw. It's not, you know, a one-size-fits-all thing. So we'll give more information about that as we go along. So I hope that's a little taster, if you like, and I'll go on to the next question, which is from Wendy Berry, who says, many of us who are carers or adults with learning disabilities have embraced personalisation with all the benefits, but additional work which that entails. Now that my son's care is funded, I have taken on a personal health budget to deliver the care to meet his extremely high needs. I'm aware that the use of personal health budgets and direct payments are now being extensively promoted as a means of meeting health needs. And I would like to know how I can plan for the time when I'm no longer around and able to undertake the extensive role I currently play in providing support for my profoundly disabled son. Even though they have a package in place and live in supported living, there is a need for me to be their advocate, help with administration, financial support. It's like you're their PA effectively, crisis management, a whole load of physical, practical and emotional support. So there's questions around, they also have younger family members, so they're obviously a sandwich carer. They've got caring from all different angles, if you like. So there's no solution really as to how to get help and support for this. And COVID-19 has really exacerbated the problems. Can any of your panel give any information on how they can get help and support if the care worker, the caregiver, gets sick themselves or their services removed? Can any of the panel answer that at all?
Hello, hi. Yeah, hi. I'll be happy to answer that, even if it is in part, because obviously it is the support, as you mentioned, children, is incredibly complex, and there would need to be involvement from social services and from other support organizations, but we can definitely get everything, support people to have a comprehensive packaging care in place. We also have an emergency plan project, if you like, and it's in conjunction with something that's called, some of you might have heard, it's called Message in a Bottle. So if somebody who looks after a relative become unwell themselves, then there would be all the care plan would be stored in a safe place, and there will be stickers, say for example on the fridge, so should the emergency services need to attend, they would know where to go for the care plan and the medical information for the person that is cared for. We also do a carer's emergency card, which we encourage everybody to carry with them. Is the size of a credit card, and you can carry it in your wallet. Should somebody become unwell, then they would be, emergency services would be alerted to that. You can actually even carry it as on a lanyard. We can help you with that. We issue those cards, and they also act as a discount card. So some, you know, on the plus side, they also do, so you can get some discounts out and about at the shops. Not that many shops are open, but also I think some online shops also offer discounts with it. But the main thing is, should somebody be out and about and they're suddenly taken unwell, if they carry that card with them, then it alerts the emergency services that there is a vulnerable person waiting at home. And we would encourage everybody to plan in advance, to have a contingency plan as to what happens if they're being taken unwell, what's going to happen. And we can certainly help you with that. We can put that in place for you, so you can have at least a bit of peace of mind in that respect if you are taken unwell. So have I answered any of that? We also do legal advice alongside that. So it's quite complex. It depends on the personal and individual need.
I think also, don't forget, people can actually contact all of the organisations that are here today and actually get more information. Yeah. So if we haven't answered your questions directly, there can be follow-up to that.
Exactly.
And also with help, you know, Healthwatch are here to listen to any issues that people are concerned about, especially to do with health and social care. So let us know those things that are worrying you, and then we can actually we can amplify your voice. If lots of people are saying something, we can actually put that to the decision makers and let people know, be aware of what's going on out there. So please do contact Healthwatch on 0208 373 6283. My next question is on behalf of Thomas Devine, who says, what assistance and supports of information are available to the older person who's contemplating purchasing a sheltered housing property? How does one avoid expensive service charges and escalating ground rent payments? Kate, can you help with that one at all?
Yes, I can try. There's the Elderly Accommodation Council, often abbreviated to the EAC. They're a national charity that aims to help older people make informed choices around meeting their housing and care needs. Again, the details will be on the fact sheet that's going to be circulated, but they have a variety of services. They've got a first stop advice service, which is independent. It's free telephone service offering advice and information to older people, families and carers about housing and care options. They've got a vast amount of information and guidance for elderly people, their relatives and carers, as well as professionals who work for them. They've got specialist directories of retirement housing developments, including sheltered and warden controlled, and different options and alternatives for people. So yeah, as I said, the details will be on the fact sheet. If there's care needs, then you can request, as I mentioned in a previous question, a care needs assessment from Adult Social Care, which is the social work team. And they may be able to offer support with housing under particular circumstances. If you are buying a property, then you can request an occupational therapy assessment for equipment within the home that might make it a bit easier for you if you've got a particular condition, if you struggle with mobility, for example. So I hope that does that give a bit of an answer to the question, hopefully.
Okay, yes. I'm going to have to move on because we're running out of time. We've got some more questions to ask. So a question on behalf of Christine, who says, what is known locally about the way DNR, do not resuscitate, is being forced upon people in immoral and often illegal ways since the pandemic started? Have we got a very, very quick response to that at all? Anyone can help with that?
Yeah, Sujan, I'll be happy to answer that question. And thank you for raising that very sensitive issue. It is acknowledged that it is it's a sort of a difficult decision to make. If I could ask Claire to just put some of my slides up, that would be really helpful.
What we might have to do is share those slides, Corinna, because we are desperately running out of time. So,
right, okay. So basically, just to say briefly that do not resuscitate orders are not taken lightly at all. And most of the times, I'll say 100% of the times, the medical team will take into account the family and the patient's wish in terms of the do not resuscitate attempt. But however, can I just say that a DNR does not mean a withdrawal of medical treatment. It only means that if somebody's heart was to stop, that there would be no attempt to try and do chest compression and put them onto a life support machine in order to restart their heart, simply because when somebody is that unwell and their illness has progressed that far, the success of bringing them back to any kind of quality of life is extremely low. Only about 20% of people or even less survive resuscitation in hospital. So it's a very undignified process. It's very traumatic. It often leaves people with fractured ribs, brain damage, and profound disabilities, even if they do survive resuscitation. However, that does not mean that if somebody has an order of DNAR in place, that they will not receive medical care. They would receive all the medical care just as anyone else. They would receive intravenous fluids, medication, and all their personal care would be attended to. It's just that should their heart stop, there wouldn't be an aggressive attempt to put a tube into the airway and connect them to lots of machines, only for them to end up probably in intensive care, where they would most likely pass away several days later with very poor quality of life in the process.
That's great. I think we have to end it and go on to the next question. I'm so sorry.
That's okay. Thank you.
We can always share that if people do want to know more information.
Yeah.
So that's absolutely fine. Thank you so much. And there's a question regarding the frailty scale, the score index. How is it used? Does it have an impact on DNR, do not resuscitate, do not attempt resuscitation orders, and how transparent is it? Can it be challenged or altered? And how can this apply to younger adults with learning disabilities? Anna, are you able to answer that one?
I can answer it in part. I'll give it a go, and I think maybe there'll be people in the panel today and in the audience that, if they want to chip in with their thoughts, please do. You know, I don't know. I think this is around the living well, aging well, and the frailty index is really a measure of how fit, how well, how frail someone is, just as part of being able to make targeted interventions about the help that they could get and the support they can. The idea being that they can keep their independence and keep their health. So it's really just one aspect of it. There's different indexes that we can use. Oh, thank you, that's better. Dead screen. Yeah, so it's not the total decision maker, really. And I think that's about as in part what I can say. I'm not sure if anyone else wants to add anything to that.
Yeah, I think it's just one element that say a GP or whoever it is would have on the record, for example, that just gives a bit of an indication of what the needs of that individual might be, and it will just help guide care a little bit. But it's, you know, it's not necessarily going to be used to inform decisions necessarily. It's just partly what someone would look at, really.
Thank you so much. That's brilliant. And I have one final question. About from Mike Apple, who says, what care homes are available in Enfield for older residents who can no longer care for themselves? Well, I can answer that one. We were doing a piece of work around the care homes and different types of care homes in Enfield, and there's a massive amount of them, over 80 care homes. So there's a substantial amount of them. Some are local authority led, some are private, and there's some are more specific to certain needs. But please, there is actually going to be a fact sheet linked to all of that information. And by all means, contact Healthwatch Enfield if you want to find out more detail. And Kate, you already mentioned the EAC, is that the Elderly Care Council people that actually have lists of all the different types of care homes and what they provide and the sort of services they run. So I think that would be another avenue to pursue as well. So hopefully that's of use to the questioner.
Sorry, can I also just say, I mentioned earlier, there's the Enfield Care Directory as well. I think the link's going to be on the fact sheet, and they've got lists of care homes and specific care homes to learning disabilities and mental health and dementia. They have a list of care providers. It's not exhaustive, but it gives a selection, and there's also guidance in there and of useful organisations and things. So worth a look at if it's something that's relevant to you.
Thank you, Kate. I have to say goodbye to Dr. Davis. He has to go now, but thank you so much for your contribution, and I'm sure we'll be in touch again. Thank you once again.
Thank you very much. Thank you.
Okay, we're all still here. So we had a couple of extra questions that were outside of this particular specialism, so we're going to address them separately. But I think we've answered most of the questions that everybody has answered. If we haven't, we can come back to you. So please don't think we're ignoring you. We will actually, there was so much information here. It was so rich with data that we really need to do that independent of this meeting and outside of it. So I hope that helps. Once again, we have got the yoga session, the meditation session we'd like you to join in with. And
there's a couple of questions in the chat box.
Okay.
If an ambulance crew came to the home and it stated DNR, they would not take the frailty list into account. Is that correct? Does anyone know?
We've not got a response so far. Again, that's very specific, so we'd need to check that information and come back, I think. Thank you, Claire. So once again, thank you to everyone that's come. Please, before you go, please give us your feedback on today's event. We'd love to hear your thoughts so we can improve things. The link is going to be in the chat box. or you can give us a call and tell us what you think ultimately. And do stay with us.
So Jane, can I just add one little insight, not in answer to that person's question, just about the London Ambulance Service. It was something that our first contact centre told me quite recently, is that since really over the last year, maybe because of the pandemic, maybe because they've had more education in their service, they are also calling through to our first contact team for advice and support. So a lot of the agencies all support each other with advice as they're going along. I was quite interested. It's not just, you know, families and the GPs calling our centre for advice.
That's fantastic. And before we go, is there any other any burning questions that anybody has for this panel before we go on to the lovely meditation session? I can't wait, quite frankly.
There was a question, Sue Jane, about how would somebody has asked how would they be contacted by the GP if they're a carer? How would anybody know? So my answer to that would be that if you are a carer or you need the support services from your GP, do let them know that you're a carer. And obviously also come to us, we can support you with that. If there is a communication issue with your doctors, let us know, we can support you with that.
That's really important, thank you, Corinna, because obviously a GP may not know that you're a carer, and that has, you know, implications as to if you're not well, and also for managing being a carer, because it's another job right on top of everything else you're trying to manage too. So it's a way of supporting that individual. So do let your GP know that you are caring for someone, albeit unpaid, albeit unofficial. Often they're the carers that are doing the longest hours. So thank you very much. Thank you for that.
Thank you.
Any other questions, Claire, in the chat box that I've missed?
I can't see any more questions, but is there anyone, because we have got a few minutes before we need to start the meditation session, is there anyone that wanted anything to go over? Because she's starting at 12:10 because the session's due to end at 12:20. So if there's anything that I know there was so much information and everybody had so much to say about their own services as well, and because we all between us have so much information to share for you, there might be just any particular point that anyone wanted to go back on just to cover a bit more clearly or in more detail, you know, just write in the chat box or unmute and speak. It's open to you guys.
And like I said, this is just a taster session today. This, you know, we couldn't possibly cover all of these really important subjects in depth. It'd have to be a separate session almost on every single one. So I think this is just a way of showing that we're working together as a team. All these services in Enfield are very much looking to support local residents. So it's very much about, you know, saying that we're here to help you, albeit in a different way now. You know, it's all very much online or by phone now, but please do get in touch with the respective organisations. We will be having the fact sheet on our website, and we will be able to share that if you've already given us your email as part of the process for actually registering today. We can actually email a copy to you if you'd like us to. Happy to do that.
Another question in the chat box: how are we reaching those whose language is not English and the frail and elderly?
I can answer that, but it's always a challenge because obviously not everybody reads in their own languages that they speak, so that can be another barrier. But it's actually working with all the different agencies. I know that all the different agencies here will be working with faith groups, they'll be working with local community groups, looking at ways of translating documents if they're already out there. I know that at Healthwatch we do have links to all various health specific information that you can actually get that's already been translated by the NHS and others. But it's also working with those communities and the community leaders to spread the word. And I think a lot of us do that by informal means, by social media. You know, there's lots of different groups out there that we work with. And we've just done a report actually on the impact of those most affected by COVID in the BAME community. That's the Black and minority ethnic community. So that's on our website too, so have a look at that and how that highlighted the needs that are there. And again, if people are finding that language is a huge barrier or there are problems, then let Healthwatch know. That's what we're here for. Thank you.
And we have another question, or a kind of a statement, observation really, that Enfield Carer Centre has given quite a lot of information today regarding the question on carers. But it's those that work for the care person who is not a carer, they're being missed by their GPs.
Sorry, so can you just repeat that question again, Claire? So
it says, thanks again, ECC, but it is those that work for the cared person who is not a carer that they are being missed by their GPs. Cared person. Yeah, it's a. I'm not sure.
Okay, so what? Okay, so just to sort of let you know, just to clarify, if somebody provides care unpaid, so we support unpaid informal carers. If you are a carer working from an agency, so a care support worker, then you wouldn't be able to register with us in terms of support services. We are supporting people who are caregivers, so informal carers, unpaid carers, people who have given up their time, energy and efforts towards somebody who is a relative, a friend, so in a personal capacity. If it's work related, then ECC is not the organisation that would be able to support you. So just to clarify that, does that answer the question at all?
I think it was referred to people that are paid carers, and how do they get help and support? I would, obviously their employers would be the first point of contact to find out what is available to them, both on an emotional level of support and help and a practical level, and with regard to the vaccine as well. Equally, that would be something that their employer would have to look into effectively, because they wouldn't come under the informal unpaid priority at this stage. Things are changing very fast, so again, keep a lookout on our website and do sign up to our newsletter, because if things change, then you'll be first to know. I hope that's helpful.
Okay, I think our meditation lady is here.
Fantastic. Hello, Jackie.
Hi.
We're really looking forward to this, so thank you so much for coming along today to give us a wonderful, relaxing start to the afternoon. Thank you.
I think, Kate, you were going to introduce Jackie properly? She's one of your contacts, isn't she?
Yep. Okay, thank you, Jackie. Thank you so much for saying that you will come and do a nice relaxation session for us. Everybody, introducing Jackie. Jackie very kindly helps out us at Age UK Enfield. She does weekly yoga for us, and she's joining us today to help us relax a little bit after this session. So I'm going to hand it over to you, Jackie. Thank you.
So it's whether you're seated or if you want to lay on the floor, it's completely up to you. So you can do this seated or lying down. It really, your choice. Okay, so first of all, just whatever you're doing, make yourself comfortable. So if you're lying on the floor, just let your arms come out to the side. You can keep your legs bent. If you're sitting on a chair, just let your hands rest on your thighs, but keep your spine nice and tall. Okay, now I want you first of all to look up, up to your eyebrows. Just look high up to your eyebrows. So you're straining your eyes. And then just let the eyes soften. Close your eyes and just feel all the muscles in your eyes relax. Now start to become aware of your breathing. Breathing in through your nose and out through your nose. Now if it feels uncomfortable, you can breathe out of your mouth. Just feel the shoulders soften and release. Feel your belly soften and release. Now be aware of the 4 parts of your breath. Your inhale, pause, the exhale, and the still point. So I'd like you to be mindful of that pause and the still point. So inhale, Pause. Exhale. Still. We're never in a hurry to take the next breath. Inhale, pause. Exhale, still point. Inhale, pause. Exhale, still point. And just observe the breath naturally slowing down without you trying to slow it down at all. And if your mind starts to wander, focus on your breathing. It's a tool that you can always use. So I'm going to read you a poem. So while you're in this nice, relaxed state, just listen to the words. Or don't listen to the words. It's completely up to you. So my wish for you this year is that your feet and your heart stay warm. Don't let the world make you cold. That you know how strong you are. That you should stop doubting yourself. That you are able to feel at home, safe, and loved inside your own skin. That you find your purpose in life and that you go for it with everything that you are. You were put here for a reason. And you make time to enjoy the little things in life. Breathe them in. Surround yourself with good people. Bright souls that make you feel wanted and loved. And know that you are worth loving for exactly who you are. Let me repeat. You are worth loving exactly who you are. Just stay here for a few moments. And again, bring your awareness to your breath. The coming and going, the in and the out. Your natural breath. And just repeat in your head the affirmation. Or out loud if you want. I am calm. I am calm. I am calm. Now slowly, I'd like you to start to bring yourself back to your rooms. Just be aware of the floor you're lying on or the chair that you're seated on. Just be aware of the floor beneath you. The earth that will always support you. Listen to the sounds outside your room. And then listen to the sounds inside your room. We're going to start to move our bodies. So I'd like you to just start by wiggling your fingers and your toes. Just feel the energy sparkling from your toes and your fingers. Turn your head side to side, release that neck. And then we're going to bring the arms out to the side. I want you to take your arms all the way up to the ceiling. And just have a big stretch. Reach up and breathe out with a big sigh. So you're releasing anything you're holding on. And again, breathe in. Nice big stretch if you want to. If you've been sitting there a while, stretch those legs out as well. And breathe out. And one more. Breathe in, bring those arms up. This time, bring your hands down to your heart. Thank you. Well done.
That was wonderful. Thank you so much. I could do that every day. Thank you. Honestly, it's beautiful. Thank you so much. And I hope you all enjoyed it. That stayed with us for that lovely little session. It was fantastic. And a special thank you to our wonderful panelists. You know, you were great today. I really appreciate your time coming to actually help and assist us with this. It's wonderful having such great partners, so thank you. It really is great. And we're going to be, like again, please, we're going to be sharing the information. It will be in a fact sheet, and we will be getting it out to people. So do get in touch if you've got any questions or queries. We're happy to help. You know about these wonderful organisations now that we're partnering with. Ask them as well if you've got any questions or queries or you need support from them. I think that's everything we need to say today. Thank you once again, and look forward to the next session. If you've got any ideas for the next session, please let us know. And don't forget to do the survey at the end to let us know what you thought of the session today. We'd appreciate your help. Thank you once again, and everyone take care. Have a great afternoon.
Thank you. I think we all need a holiday soon, don't we?
I like that. Yes, exactly. I can't do that, but yeah, we'd love that.
Yeah. Thank you very much. Thank you so much.
Thank you, Jackie.